Hello, I'm Norman Swan. Welcome to this Rural Health Education Foundation program.
The Rural Health Channel will broadcast to more than 250,000 healthcare workers and households across rural and remote Australia. These people are isolated. They don't have the easy access to healthcare information and education that those in metropolitan areas enjoy. Access to the internet is improving, but is still often limited or unreliable in these distant corners for viewing longer programs. Health professionals working in these areas must travel for their professional education. This is costly and takes them away from their patients and families. The impact of this lack of information can clearly be seen in the increased rates of chronic disease and early mortality in these communities. People deserve the best quality healthcare regardless of where they live. The Rural Health Channel will help healthcare workers keep their skills and clinical knowledge up to date and improve community engagement in their own health and well-being.
Congratulations to the Rural Health Education Foundation for the launch of the Rural Health Channel. This is a very important initiative because what it does, it tries to level the playing field. It allows people in remote areas to get access to information that's generally only directed towards people living in urban environments or where there's close access to television and other resources.
The ability of this kind of service to reach the whole population, the free-to-air service, is absolutely fantastic, and it's the kind of resource that we've needed for a long time to be able to connect people and to make sure that people that live in rural and remote areas have access to the same kinds of education and information and services via television that the rest of the population has.
All of those people who might have been in black spots in terms of receiving information about important health messages can now get those messages. So this is great not only for health service providers but also for the consumers and members of communities in remote areas who can get the information which will help them look after themselves and help endorse, augment their health services. So it's good news on all fronts.
It's a very testing sort of practice in rural areas. It's extremely satisfying. The opportunity to provide often cradle to grave care is an honour. But it's an honour that comes with a lot of responsibility, and it's responsibility that often that many of us find quite difficult. So an opportunity to access, as I said, good information and information that understands the sorts of challenges that we face, well, we welcome it.
Yeah. I'm Sally Laws. I'm working in northwest Queensland, close to the Northern Territory border, in a single nurse clinic. It's a primary health care clinic. We look after a population of possibly about 300. Some of them work on cattle stations. A majority are the Indigenous population. It's a passion, doing remote nursing. You can practice with more autonomy. You learn a lot more. You're basically nursing by the seat of your pants in some instances. I'm on call 24 hours a day, and for example, last weekend I was called out 2 or 3 times overnight and the weekend before. So I don't really get a lot of spare time to be trying to do professional development. However, this rural remote nursing channel or health channel is going to be a great way to pick up on new things that are coming out in education, so it'll be great. It's very important because in a lot of areas, like especially in this emergency room, it's really important to have updates all the time on the use of the equipment that we need to use, the drugs that we need to use, because we constantly need our skills kept up to date.
My name's Jess Donegan. I'm an occupational therapist, and this is Halima. She's a social worker, and Pete, my colleague, who's a physiotherapist, and we work for North West Queensland Primary Healthcare. Being in a remote location, it's often difficult to do CPD because it costs lots of money and takes time out from your work, and it's not often people to replace you.
And so the new channel, the Rural Health Channel that's coming to you, what are the sort of programs or content that might be useful to a varied allied health team such as yours? Specifically,
I like specific information on different areas in relation to neurological conditions, paediatrics. Those are the sort of areas that I see a lot in communities. and also more generally in regards to health promotion, which is a large part of our primary healthcare role in communities.
I'm interested to know what difference you think the Rural Health Channel might make around here.
Having a free channel like this with up-to-date, relevant and unbiased medical resources like that is a bonus both for the patients, the families and the practitioners. In particular, I found it's been highly useful in developing some practice skills through lines of questioning and techniques, particularly with some of the mental health segments that have been covered, that would open up and really allow you to explore some of the issues for your patients and really be able to make a difference when those experts in those areas are not readily available. It's a really good educational tool to build your own skills, resources and knowledge base that's not always able to be achieved through textbooks, to build on your professional development and your future practice.
So the Rural Health Channel, what do you think it can offer you here as a health professional yourself, but also in your practice environment? Tommy?
At this point in time, I believe this is why it is lacking in communities where, you know, people, they can't get the community interested in doing professional development. There are people who really want to do it, but they don't want to leave home. Yeah. And I believe if this can help them, you will find more and more people in the communities helping their own people to educate and this is what it's really needed, especially with so much chronic disease around. Yeah.
And just because we live out here, we don't think that our nursing care should be a substandard. It's definitely would help us to keep our skills up.
Well, I suppose the Rural Health Channel now, if people are going to have their own boxes and be watching the channel, it certainly can be done in people's homes, in town, but we'll probably still focus on having meetings where we get together and we participate as a group, because that enhances group discussion in our own environment and we can then discuss our own patients, our own circumstances.
The Rural Health Channel is an Australian first and one of the most progressive health communication platforms in the world. It will deliver immense health benefits to Australians living in remote areas.
So congratulations to Rural Health Education Foundation and everybody who's worked to get this channel up and running. Thank you to the government for their support particularly, and to all the sponsors who provide us support to be able to get information out to you who live in rural remote Australia.
I'd love to congratulate the Rural Health Education Foundation on this fantastic resource that I know will reach a lot of our disadvantaged populations that live in rural and remote areas.
Yeah, look, so I'd just like to congratulate the Rural Health Education Foundation and everybody involved for this terrific initiative. It really is going to make a big difference to the way that people get their health messages in rural and remote areas. So well done to all involved. Keep up the great work.
And for those of us who live in rural and remote communities, we want to say thank you. Thank you that you're acknowledging the real needs we've got, and thank you that you are contributing in such a positive way to reduce the professional and personal isolation that we feel. So thank you.